Hello viewers and learners of the NEV 002 course, that is Environmental and Occupational Hazards. I introduce myself as Dr. Sushmitha Baskar, working in the discipline of Environmental Studies at the School of Interdisciplinary and Transdisciplinary Studies, Indira Gandhi National Open University, New Delhi. So now we will discuss about the hazards that are faced by the healthcare workers, and we'll give a special focus on the biological hazards. Now we can see that the hospital workers and those who are working in the healthcare areas like hospitals or in medical centers, in clinics, so they work with infectious agents that could be samples from the human body, that is the fluid, the blood. Then they also deal with the needle sticks, with the syringes and the drip bottles and so on. So can there be any infectious agents, biological agents that can be transmitted from these sectors? That is what we are going to detail upon in this module. Now the learning objectives of this module include: after listening to and reading this module, you will be able to explain the various biological hazards that are faced in the healthcare sector. Now the hospitals are those institutions where people, like when we are sick, we go there for treatment to become healthy again, to recover from the infectious diseases that we have been attacked with. But they can also expose the healthcare personnel and other employees, even the doctors, even the nurses, all who are working there, even the hospital staff who are involved in the cleaning, in sanitization program, the other personnel in entire hospital sector, they have a considerable amount of getting exposed to the occupational and the environmental hazard, and thus they can endanger their health if they do not operate under safe conditions and if they do not wear the proper personal protective equipment. And many of these hazards can also be dangerous and they can also be fatal, because infectious agents and infectious diseases, either you can get transmitted from the disease from like the surfaces or even from one person to another. So human to human transmission also can occur. Now in a hospital there are varying degrees of staff and all of them are exposed to varying degrees of risk. Now for example, some person may be, he may be more sensitive, or he may be metabolically or immune compromised. In that case they may be more vulnerable to the attack of certain infectious diseases. So the individuals who are involved in direct care of patients, like the doctors and the nurses, they are at the highest risk of contracting the biological hazards. That is why they need to be properly equipped with their the face shields, with the mask, with the gloves and all other protective substances that can actually protect them from contracting such kind of infectious diseases. Now similarly, the laboratory workers, they also handle biological samples, human tissues, and they are at a risk of getting infected from the samples if they do not handle them in the proper manner. Because when they transfer blood from one test tube to another test tube, or when they are collecting blood from one person, so the blood itself, that itself may contain certain infectious agents. So all this they will, if they do not follow the standard operating procedure and they do not take proper precaution, then they have the risk of contracting the disease. Healthcare workers and the waste handlers also are involved in collecting, transporting, storing and the disposal of the healthcare waste, and they are also at high risk of getting the infectious disease and physical injuries in the form of cuts, pricks and bruises. Because even in when your any part of the body, your skin, you have faced a prick or any cut, in that case the infectious organism can even enter through those bruises and those cuts. So again you are vulnerable to the attack. And many of these accidents can be avoidable if the proper precautions are taken well in advance. Therefore, the hospital should be made a safe place to work with. Exposure to the biological hazards. Now this is also common when the nurses and the nurse assistants, when they take care of the patients, because the patients are unable, they are incapable of taking care of themselves. For example, in the heart failure patients or those who are suffering from the liver ascites, when the abdomen becomes totally distended, there is collection of water in infectious material sometimes. And in that case the patient is not able to take care of himself. So he needs support, he needs help from the nurses and other hospital, the ward boys. So when the doctors also, they make the clinical examinations, they also need to take care, they need to examine every part or every organ that is affected. For example, a patient may have cellulitis, and that is some infectious pus which is coming out from the skin and other parts of the body which are affected. due to certain bacterial infection. Same way there is a problem of gout. So in many cases there can also be infectious abscesses, then pus, for example in the herpes, in chicken pox. So all these are infectious, the skin, the liquid and all that fluids, the body fluids which are being exposed, and when the doctors make clinical examinations, they also expose them to the risk of these biological agents. Now doing other activities like disinfection, cleaning, transporting the contaminated equipment or working in contaminated areas, they also will expose the hospital people in the healthcare settings to a variety of the biological hazards. Now, one solid example is the Ebola virus. This actually spread and it was a recent one, and this is a very serious biological hazard, and it is transmitted by the direct or indirect contact with the organic fluids of the infected patients. Now, this is of great concern, especially in some densely populated African regions. Now, here there is actually an overlap between the human and the animal ecosystem. That dense population exists over there. And it also includes the primates and the bats, what is now thought to be that they are the reservoirs for the Ebola. So even climate variability, weather and also the environmental quality, all this can also impact the survival and the transmission and distribution of such kind of infectious viruses. But it has been a relevant problem for the healthcare workers from Europe and North America who had worked with the patients from the countries where this infection was endemic and also during the epidemics. So this was really difficult for the health workers, and they had to really equip them with the proper equipment, personal protective equipments, before they could actually go out there to help the others. Now, hospital hazard. So how can we define this hazard? It is any substance or activity that directly or indirectly causes hazards to the healthcare workers. Now this can include the physical hazard, the biological hazard, chemical hazards, radiological hazards, ergonomic hazards and also the psychological hazards. So these are the different types of the hospital hazards which we face. Now the healthcare workers may come in contact, as discussed earlier, with a number of sources, and that may be through the patients or indirect with the contaminated materials like the body fluid, tissue. It could be even laundry of the patient and also the contaminated surfaces. So all these need to be taken into account. Now biological agents. So when we define a biological agent, we say that this could be anything of biological in origin. That is, it could be microbial, belonging to bacteria, viruses, fungal. It could be certain zoonotic agents. It could be vector-borne or non-vector-borne diseases and so on. Now, the infectious patients will add to this biological load. So when you have infectious patients, that is why it is very important to isolate the patients who are having infectious diseases, so that they don't transmit it from them to another. Isolation wards are specially created for this. And for the non-infectious, for a very normal thing which is non-infectious for them, then there is no problem of even in one general ward, many of the patients can be accommodated. Then it is that way we can now see that the hospitals are full of the hazardous pathogenic germs. Why do you think it is so? And these pathogenic germs, they can include those of the microbial kingdom, that is the bacteria, the viruses, and even parasites and fungal diseases are also on the rise. So these are all microparticles, they are invisible. It is difficult to apprehend the risk they pose, because the biological agents, you can't smell them, you can't see them, and you cannot even, you can't hear them. It is not creating any explosion like in the case of a nuclear bomb or anything else. So that is why biological agents, they need to be understood well, and a good variety of research has been done, including in the hospital sector in these terms. Now, the biological agents, in one way they are important because they can replicate rapidly. Now, even if you take a bacteria for example, there in 20 minutes, it gives rise to the next generation through the process of binary fission. So it can give rise to a number of the bacterial species within 1 hour. That is why when you don't take the proper medicine in time, the bacteria will replicate, and for example in the urinary tract infection, UTI, okay, you find that the bacteria replicate, and sometimes it can lead to pain, it can lead to the bloody urine, that is urine which is blood red in color. So because the bacteria have multiplied so much, so unless you take the proper precaution, giving the right medicines, only then the right antibiotic, only then it will stop. And fever is one symptom, that the body gives, that the body is trying to fight those bad cells or those microbial cells. So in a hospital setting, the exposure to a biological agent, it can be unintentional, because intentionally nobody releases the microbial agents in the healthcare or the hospital sectors, because that is a place where we go to make ourselves alright, where we go to cure ourselves. But the staff, because they work directly either in the laboratory or with the patients, the employees are exposed to these agents as a result of the work that they do. So they are a result of the occupation that they work with. So they are referred to as the occupational hazards. Now, blood-borne germs, okay, these are very important, and they are pathogenic microorganisms that are present in the human blood and can cause disease in the humans. These pathogens, they include the human immunodeficiency virus that causes the AIDS, the hepatitis B virus, hepatitis C virus and others, which causes jaundice and the infections in the liver. Contact with the blood, either through needle stick or through other accidental exposure, this can also put the hospital staff at risk for AIDS as well as other infectious diseases. Another major route among the healthcare is airborne. So sometimes you can even inhale certain viral particles. So by sneezing or by coughing or by all these mechanisms, the bacteria or the pathogen, the virus, can be transmitted in the air. So they can be airborne. The small particles, they remain floated in the air for some time. The larger ones, they precipitate in the ground and then they get deposited even as a droplet nuclei. Then these can enter the healthcare professional's body either through ingestion or through inhalation. Sometimes the skin, the derma, the skin can also absorb a large number of the pollutants. Now, the major pollutants or the pathogens that enter the blood through the respiratory tract in the hospitals are the germs that cause tuberculosis, that is caused by Mycobacterium tuberculi, influenza virus, the severe acute respiratory syndrome, that is SARS, and COVID is also a SARS type, and also pneumonia. In addition to this, the hospital settings, the droplets can also be artificially generated during suction of the respiratory tract. So many of the pathogens are transmitted through close contacts and they are spread by skin to skin contact or with other surfaces, for example the herpes simplex virus. Okay, herpes, you might have seen this as small like the chickenpox variation, that which occurs on the skin. It's also a type of variola virus, just like in chickenpox, and you can see that there are bumps on the skin. So the herpes virus also, unless you give the proper treatment at the right time, though viruses do not have any medicine, but there are certain antivirals for some diseases, and these are called as a fomite-borne pathogens. Some of the common germs that are transmitted to the healthcare workers, they can be classified as a human immunodeficiency virus or HIV. And this has forced us to recognize the potential dangers that are being faced by these occupations and by the people who are working in these sectors. So a lot of precautions have to be taken in this case, and in the modern day pandemic, caused by this HIV, it can be transmitted through inoculation injury, and that is why every time you need to collect your blood either for the diabetic test or for any other blood related blood samples are always collected for any reason as prescribed by the doctor. So you need to ensure that the laboratory uses a new needle, and they do not reuse the same needle. In the same way, even when you are giving blood at the blood banks for collection, or if you are giving blood for any other reason, then you need to ensure that the fresh needles, they are opened in front of you, and only that is inoculated into the body, because there is a risk of transmission of the pathogenic agents through blood. Now, the risk of transmission, there is also there from HIV positive individual to an HIV negative through needle prick, and it depends upon the many factors. In the same way, hepatitis virus. So as discussed earlier, this is due to the inflammation of the liver, and it can lead finally to the liver damage and death. So it is also caused by a virus and transmitted through needle stick injuries. Hepatitis B is also recognized as an occupational hazard among the hospital personnel. According to the WHO, the World Health Organization, the prevalence rate of this is 3 to 6 times higher in the hospital staff than those which is noticed in the general population. Now, the most common transmission of the HBV, that is a hepatitis B virus, it is the blood. So now we are seeing that like the doctors, the healthcare personnel like nurses and doctors are given the complete course of vaccination also for this, because vaccines exist for some of the viruses. But the risk does not get completely eradicated. There are concerns sometimes of vaccine failure or lack of knowledge about the duration of immunity in those who have seroconverted. So these problems also arise. Now the likelihood of contracting the hepatitis B is much higher than the likelihood of getting the HIV. So since half of the infected patients are asymptomatic and the disease develops at a later stage, the hepatitis B is almost always fatal. Another hepatitis virus, that is a hepatitis C virus and infection. This is also a major cause of the bloodborne hepatitis, and it is also caused by the needle stick injuries. Now this also represents no symptoms, but it can become chronic and it can lead to an active liver disease. Tuberculosis. Now tuberculosis is also a public health problem in many developing countries, and according to the World TB report which came out in 2018, and that was also released by the World Health Organization, India accounts for nearly a fourth of all the TB cases detected worldwide. So why do you think this is due to? Maybe unhygienic surrounding, the environmental quality, and people spit on the road. So through the mucus, the saliva and spit, the tuberculosis bacteria can flourish and they can survive. And again, contact to contact also, because the TB patients have to be isolated, and the BCG vaccination is given to all the children and all people. But sometimes when in the rural areas, the people are unaware of the same. So this also gives rise to a high distribution of the TB in a densely populated country like our nation, India. So the mode of transmission is through droplet nuclei, through saliva, through the mouth secretions and so on. The bacteria exit through the nose also when the TB patient coughs, sneezes or he shouts. So thereby the health workers can be affected by this disease. And those who are working in the chest OPD, because in the TB they normally do a Mantoux test where the test is done on the patient, and then again the chest X-ray is done just to see if the lungs are affected and whether there is any all those the white patches that you see in the lungs. So these things are being handled by the healthcare workers. So, and they are all done in the concealed workplaces by the hospitals, and that there they have a highest risk of contracting this TB infection. Now in the TB also it could be pulmonary tuberculosis, which is very infectious, and active pulmonary tuberculosis, those patients should be kept in isolation, and the room also should be well ventilated. But in overcrowded public health facilities, so normally like people tend to ignore where it's a normal cough and you get better. But if it is a chronic cough and then the healthcare workers readily get infected with this disease, then they need to be checked and action has to be taken. And with the rising number of multi-drug TB also is now occurring, because some drugs like rifampicin and all are given for the tuberculosis. But the TB bacteria are also getting multi-drug resistant. So that is another problem which is being faced in the environment, and so treating this becomes even more complex. These are the routes of exposure of certain harmful germs. You see the route and you see the examples. Skin and the mucous membrane. It could be through the bloodborne viruses, then the hepatitis B, C virus, human immunodeficiency virus, hepatitis D virus, viral hemorrhagic fever. That is a symptom that is caused by inhaling certain harmful biological infectious agents. Tuberculosis, SARS and influenza can be caused by ingestion, that is through the mouth. Then enteroviruses can be ingested, and also typhoid bacilli caused by the Salmonella species, that also can cause harmful exposure. Now, the infections are among the most important occupational risk for the healthcare workers. So some of the infections can be prevented through vaccination, but for others there are no vaccines to prevent them. So because of the problem of the drug resistance, as I told you, so there is no vaccination in that case, because even every organism, they are continuously mutating in the environment and taking up different forms. So precaution should be taken in regarding the transmission route, the contact isolation and respiratory isolation for protecting the healthcare workers and other patients. So dear learners and viewers of this course and module, we have actually outlined the biological infectious agents and hazards which the hospital care sector workers and employees are exposed to. So the people who work in the hospitals include the nurses, the doctors, technical assistants, and even the health and the sanitation professionals, and ward boys and so on. So even the patients who come there, for taking treatment for various diseases and infections, even they also can be exposed secondarily to these infectious agents. So we have discussed the bacterial agents and certain viral agents and diseases that have occurred which are really infectious, and the routes through which they can be absorbed in the body, and they are a cause of concern. Therefore, the healthcare workers need to be properly protected with the protective care equipments, and vaccination where possible can be given, and utmost hygiene and sanitation is essential in such sectors, and that will ensure the health of the employees. Thank you.